Hello everyone, today I am here to explain you the nursing responsibilities before, after and during blood transfusion. Make sure that your advice for blood transfusion is documented in your doctor's note. After advice, fill in the blood requisition form with all the details like name, age, sex, blood groups, various screening, patient's IP number, blood component, required quantity, and give EDTA sample. Before sending the requisition form to the blood bank, double check the form by senior nurses and doctor and get their signature on the requisition. Double checking will avoid any kind of mistakes in the form. Make sure that the EDTA sample you are sending is labeled properly. That if the patient is positive with the viruses like HBsAg, HCV, HIV, then don't forget to label it with label the requisition and the vial with the color coding sticker which reflects the diagnosis the patient has. Take consent for transfusion. Before transfusion, make sure that the blood is not too cold. Confirm and double check the blood grouping biomarker cross-matching with the laboratory before starting a blood transfusion. Ask for any history of blood transfusion previous or any kind of allergy to it. Check the vital sign and record before blood transfusion. After checking, check whether you receive the same blood products, you are receiving the same blood products with same grouping components or not. Check the level for blood group collection, date, expiry and all the details, whether they are matching with the patient data or not. Get it double checked by senior nurses or nursing in charge or doctors and get it signed on blood transfusion monitoring sheet. Check blood bag for any leakage, blood clots and abnormal color change. This proper blood transfusion BT set is specially used to transfuse the blood products. Check the patency of the IV cannula. It should be at least 18 gauge. There should not be any sign of phlebitis. If found any blockage, then please change the new one. Confirm whether to give any pre-medication to the patient like laxatives and Avil if advised by the physician. If blood transfusion is done due to low hemoglobin level, then please double check the report with the name and UHID whether the report dispatch is correct or not. Make sure to wear the PP and explain the procedure to the patient before transfusion. Document all the vital signs before starting the procedure and mention the starting time of the transfusion. Monitor the vital sign frequently throughout the process. Should be more careful in first 15 minutes of blood transfusion because the patient may develop transfusion reaction during this period. Use standard monitoring sheet in your hospital. Don't transfuse too much fast because due to it, patient may have acute ventricular failure or transfusion associated circulatory overload. And don't transfuse more than 4 hours because prolonging the procedure may damage the blood products and may become infected. After finishing, floss the cannula with normal saline. Check post-transfusion vitals and document in nurse's note and the blood transfusion monitoring sheet. Mention the completion time of transfusion. Remove the label of the blood bag and stick it on the nurse's note and document about the procedure. And also document it in intake column because it should be included in the fluid calculation and totaling of patient fluids. If patient develops blood transfusion reaction, then stop the blood immediately, then floss the cannula or keep vein open because we need the patient vein patent to administer the medication for reactions. Monitor the vitals regularly. If you notice breathlessness, then keep the patient in semi-fluid position and then administer oxygen. Check the vital signs every 5 minutes and inform the doctor. Give medicine as per the doctor's order or as per the standard operating standard of the hospital. In case of minor reactions like itching, infusions can be stopped with the doctor's advice and antihistamine can be given if there is mild allergic reactions as advised. Collect the urine sample and send it to the laboratory and lab to check the level of hemoglobin, which may be the result of RBC hemolysis. After stopping, blood bag, IVC and EDTA sample should be sent to the lab for analysis. All the events should be documented in the nurse's note regularly without fail.